So thinking, eating, and activity. The acronym is T. The objective for exercise or activity would be to get out and move. Humans were meant to get out and move. You know that if you stay stagnant for a certain amount of time in any one position, sometimes you get achy, muscles will hurt, you'll feel kind of tight. So movement is inherent in our nature. We kind of postpone movement or activity or exercise, if you want to just call it that, because we have other things that are more important. And I think the activity part gets put to the bottom of the list as far as prioritizing. My suggestion is that because we're going to suggest, or because we want to make sustainable lifestyle changes, you do what your body and your life can afford, but you also do what is good for it. Activity and thinking can actually be put together. That's why I put in the up-and-coming slides, buy one, get one free. You can actually introduce in the next 21 days breath exercise. Breath exercise isn't like preparing for a marathon, but it does help, especially if you're crunched for time. So breathing in the form of 4-7-8, in the form of just meditative visualization, in the form of guided imagery, or even if you just want to do yoga exercises of breath, or pranayama, that will be fine. The objective is to practice whatever you choose, 10 minutes in the morning, 10 minutes at night. And here's the reason. Exercise is a feel-good pill. It usually, after the end about 20 to 60 minutes of exercise, you feel good. The reason is that you release endorphins and enkephalins. Those are two hormones that the body has been known to produce in stress or fight or flight. The objective is if you break a bone or if you're bitten by an attacker, a predator, then you don't just sit there and embellish in the injury and writhe in pain. You keep on going. So the body is this built-in mechanism where if you have a little bit of discomfort, the brain releases endorphins and enkephalins to postpone the sensation of pain and have you continue with fight or flight. We can use that to our advantage as far as exercise, because most people that do run or cardio or weight training, they feel really good for about half an hour to an hour. The drop-off is fast. Again, it's supposed to be fight or flight, even with regards to a broken bone. The sustaining relaxation that you'll feel with exercise is usually because, in my opinion, usually because of the serotonin effect. After that endorphin and enkephalin has gone away real fast, serotonin is released, oxytocin is released because the body enjoyed what it did. That lasts in your system for a long time. If you remember what serotonin is, it's a feel-good hormone too. It makes you happy, makes you smile all day. In fact, those of us who are missing that hormone or not making enough, the doctors, my colleagues, can actually make or give you pills that give you a false sense of serotonin increase, and that's Prozac, Paxil, Zoloft. Those medicines are used to increase or boost serotonin, kind of in a false way, and they're used for major illness, major depression, anxiety, but I think they're being overutilized when actually you can get out and walk, do breathing exercises, calm down, work on thinking and relaxation. So that's why I combine the two things. The 2 for 1 or buy one get one free slide, it points out the fact that you can actually, if you're starting up, combine breath exercise, which helps with calming down the brain, controlling the stress response, and releasing the serotonin into the bloodstream. It also prepares you for some form of exercise. Exercise or breath exercise, pranayama in yoga, isn't necessarily the same thing as running a 5K. It's not like you're not going to get the results of lifting a great deal of weight, but you'll prepare and do better with your endeavors. Again, if we're talking about changing or introducing a lifestyle change, I want you to start with something real easy. And that's where this comes in handy. So the buy one, get one free, as far as my 3 points of the anti-inflammatory lifestyle change, it's thinking, eating, and activity. Well, you got 2 out of the way, you just have the eating to work on, and usually eating or your nutrition, your hunting, will be controlled if you can control that stress response. I just heard a story about this guy who was going to Mariano's. It wasn't a story, one of my patients went to Mariano's to eat a pizza. He had a craving for a pizza. He saw a veggie pizza, which is very healthy, but he asked the guy how long would it take, and the guy said 10 minutes. And he couldn't wait the 10 minutes. He was already hungry, and the stress response was telling his brain, I want to eat now. So that's one of the problems with not having the stress response controlled, or I should say not practicing the relaxation response. It's also a problem of not eating properly, or waiting until the last minute when the brain has said, I am starving. And at that point in time, the body is just hunting, and you want that food now, and you're going to be frustrated. So you see how eating and activity and thinking are all related. So hopefully this helps with